Coming today to hear me talk on colon cancer. And what I'd like to do is talk to you for about 15-20 minutes, give or take, then open it up for questions. And if that's okay, we'll begin. My name is Murray Scheinman. I'm an internist at Weiss Hospital, been there for nearly 30 years. And what I'm going to do is pretend that you are my patient and you're coming in to ask me about colonoscopy and colon cancer or colorectal cancer. And I'll just pretend that we're having a conversation, if that's okay. So this is Colorectal Cancer Month. And colon cancer or colorectal cancer are interchangeable terms. They're the same thing. I'm not going to show a bunch of slides, and I'm not going to bore you with a bunch of statistics. This is just going to be a conversation. In fact, it does my heart great joy to see people with their slide presentations and they can't get the technical stuff to work. My heart sings with joy when I see that. So this is just going to be a simple conversation. Cancer, big concern of all of us. The three most common cancers we see in men are prostate, lung, and colon cancer. In women, we're talking about breast cancer, lung cancer, and colon cancer. It's number 3 on the list. It's not as common as the others, but it's important because it's potentially preventable. So a moment to speak about screening tests. What are screening tests? Screening tests are tests we do to try and detect and prevent illnesses. So for example, doing a CAT scan on everybody's head looking for brain cancer would be a good way to pick up a lot of brain cancers. But since we can't do much about them, it makes no sense to screen for them. On the other hand, take for instance, a mammogram. A mammogram is a wonderful screening test. It's cheap, it's easy, it can find early cancer. And if we find a cancer early, we can treat it. And that's a wonderful thing. So a mammogram, for example, is a terrific screening test. For lung cancer, there's x-rays and scans we can do looking for it. For prostate cancer, we have blood tests and a digital exam to try to find early prostate cancer. Colon cancer is a problem. Colorectal cancer is a problem. We don't have a good scan for it. We don't have a good x-ray for it. We don't have a good blood test for it. So how do we find it? Well, I could do a digital exam and feel for it. And that's a great way to find cancer in the colon and rectum for the first 2 inches. The other 36 inches, we're out of luck. So that doesn't work too well. We could do a test looking for blood in the stool. That's a real nice test if you happen to have a bleeding polyp or a bleeding cancer. But if you have a hemorrhoid, it's going to show positive for blood. And if you have a polyp that's not bleeding, we're not going to see anything on the test. So the gold standard best way to screen for colon cancer, and again, we're talking screening. If you came to me and said, Doc, I've lost 15 pounds and I'm pooping blood, we need to do a colonoscopy. This is not a screening test. There's a problem. We got to deal with it. But we're talking here about a screening test. And the gold standard screening test is a colonoscopy. What is a colonoscopy, you may ask? Colonoscopy is a test where we give you some stuff to drink the night before that basically gives you diarrhea and cleans out the intestines. So it's nice and clean. Then you come into the hospital or the doctor's office, give you a little bit of sedation to make you sleepy, and then take a flexible scope, kind of looks like a tube with a little light at the end. And we insert it in the rectum, you're asleep, and take a look up through the colon, actually visualizing what's going on up there, looking for polyps, looking for cancers, looking for nothing. Test takes about 15, 20 minutes. It's done by a specialist, a gastroenterologist. I don't do them. You wake up, doctor tells you what the results are right there, and give you a little something to eat and drink, and you go home. The rest of the day, you're free. Going to get there. So what exactly are we looking for here? How does colon cancer, colorectal cancer, how does it happen? And what happens is, generally speaking, you develop a little polyp, a little growth in the intestine, and it's benign. It's not a cancerous growth. It's called an adenoma, and you live with it. No big problem at all, except these adenomas can become malignant. May take a while. They may never become malignant, but often they do. And then that little malignant polyp grows into the wall of the intestine, and then through the wall of the intestine into the lymph nodes, and then into the liver, and then it's bye-bye, Charlie. We got problems. So the trick is trying to find these polyps before they become cancerous. Take them out. Then we're not treating cancer early, we're preventing cancer. And that's the name of the game. And the best way we could do that, absolute best way, is with this colonoscopy. But truth be told, colonoscopy is not a really good screening test. Because let's look at that mammogram as a screening test. As I said, that's a terrific screening test. It's cheap. It's easy. You don't need a doctor to do it. A technician can do it. You don't have to do any preparation for it. There's no sedation. It's not invasive. We're not sticking anything inside of you. It's a wonderful screening test. Colonoscopy is not cheap. Medicare pays for it, but it ain't cheap. You need a doctor to do it. You need an assistant to do it. You need this special scope to do it. You need somebody to give you a sedation. You need to do a prep the night before. It's a whole process. But colonoscopies don't miss anything because you're taking a look. You're looking in the colon. You're not taking a picture. You're not taking a scan. You're not taking an x-ray. You're actually looking and seeing what's there. 99% accurate. It's a wonderful way to find cancer. Now, if you have a polyp, when they go in with this scope, they can actually snare that polyp, pull it out, and we send it to the lab to check and see if it's one of these precancerous or cancerous polyps. And if it's precancerous, you're never going to get cancer because we got it out before that polyp turns cancerous. If it is malignant, we took it out. And if we go in there and we see an actual cancer, not a polyp, but an actual tumor, we biopsy it, and then hopefully we're finding it early enough. Remember, this is screening. You're not having any symptoms. We find something, we send you to the oncologist, to the surgeon. Maybe we take it out and we get another cure. So the whole trick in screening for colorectal cancer is to find these polyps early and get them out. Now, let's say we do this scope and we don't find anything. How often should we check it again? every year, every 2 years, every 5 years, every 10 years. The rule of thumb is if the colonoscopy is negative, live and be well, we'll see you in 10 years. If we find a polyp and the polyp is pre-malignant, come on back in 2 or 3 years. Let's look to see if you grew any new ones. We took this one out, but maybe we bring you back, take a look in a couple of years. That's the short version of screening for colon cancer with a colonoscopy. Now, 5 or 6 years ago, some very clever people came up with another test to screen for colon cancer. You may have heard of it. You may have seen ads on television for it. It's called Cologuard. Cologuard is a test of your stool. Company sends you out a little kit in a box with a little container that fits in the toilet. You do your business, pour a little liquid reagent on this stool specimen, screw on the cap, put her back in the box, and UPS it back to the company. And they analyze the stool for cancerous and precancerous lesions. So in other words, it'll pick up actual cancer or polyps. You go to the doctor or to a center, sign up to get this. It's a $600, $700 test, but with Medicare, it's free. Do the specimen, send it in. A week later, I'll get a report and I'll let you know if it's positive or negative. If it's negative, we're pretty safe to say you don't have any cancer or any polyps. If it's positive, then we recommend you go ahead and get that colonoscopy. Again, this is a screening test. If you have symptoms or if you have history of polyps, this ain't for you, but simply a screening test. So the question becomes, well, can I do the Cologuard instead of the colonoscopy? This is where it gets interesting because the colonoscopy is a genuinely better test. But as I told you, the colonoscopy entails doing a prep the night before, having somebody bring you in, getting sedation, doing a test where they're sticking this scope inside you. It's expensive. It's a whole process. The Cologuard, you do it in the comfort of your home. No biggie at all. It's not quite as accurate as the colonoscopy, but it's pretty close. And especially in this age of COVID, where people don't want to go out, don't want to go to the hospital, don't want to have a procedure in the hospital, don't want to get tested again for COVID if you're coming in the hospital to get a colonoscopy, this Cologuard is a terrific option. And if you've had a colonoscopy and it's negative, then the Cologuard, again, is a terrific option. And it's free. You can't beat that. And if they send you the kit and you decide, I don't want to really do this, you throw it out, no harm, no foul, no charge, no nothing. It gives you another option. If we all, just as a thing, when do you start screening for colon cancer? Funny you should ask. If you asked me that question 25 years ago, we wouldn't start screening with colonoscopies until you were 65. That was when Medicare started paying and insurance started actually paying for screening colonoscopies. Over the years, we have found just how prevalent colon cancer is and how preventable it is by finding these polyps. So over the last 25 years or so, we went from screening at age 65 to 60 to 55 to 50. And as of last year, insurances are going to start paying for simple colon screening at age 45. If the Cologuard test is negative, we do another one every 3 years. And again, it's free. That's the short version of colorectal cancer. Bottom line is, if everybody, let's say 45 and older, 50 and older, 55 and older, if everybody were to screen with Cologuard or colonoscopy, colon cancer could essentially be eradicated. It's a preventable disease, not just curable. Again, with a mammogram, we're not preventing breast cancer, we're finding it early and treating it early. Here, the vast majority of positive colonoscopies are not finding cancer, they're finding pre-cancer. And by clipping out these polyps, we're preventing you from ever getting the third most common cancer in this country. That's a pretty good deal. So that's my push. That's my story, short story. I don't want to keep talking, bore you, and watch your eyes glaze over. I'm sure you got questions. And like I say, I'm talking to you as one person talk. I'm talking to one patient now. I say, all right, I've been talking long enough. You got some questions? I'm sure you do. Ask me questions. Let's start over here.
Okay, thank you, Doctor. Your lecture, I understand, but when they take that polyps, doesn't that leave a scar in those areas where they take it from?
So when they do, excellent question. When you do the colonoscopy and you go inside with this scope and you see a polyp, it's a little hard to conceptualize it, but the scope has a little bitty snare and it reaches in, grabs the polyp and pulls it out. There's a teeny bit of bleeding there, but it heals up within a day. If I scratch myself, I feel it, it hurts. But inside the intestine, we don't have nerve cells. It's painless. So you're not going to feel anything when you wake up from the colonoscopy. You're not going to say, oh man, that really hurt from where he did the biopsy. You don't feel anything. And it's such a little bitty thing that there's no bleeding. You're not even going to see any bleeding the next day.
Just one more question.
Ma'am.
Is it possible for it to become so form frequently in individual family? Let's say the father had it, the grandfather, is it like prevalence?
So another good question. I could, like I say, I could talk for a whole hour on this subject. That's something I didn't mention, but is there a family connection? Is there a genetic connection with colon cancer? Now, we go and stretch this out to your great-grandfather had colon cancer. I don't much care. But if your mom or dad or brothers and sisters have colon cancer, you're at risk. The colonoscopy is kind of not a screening test anymore. We're looking for it. We know you are at greater risk than the general population. So if there's colon cancer in the family, we'll start screening, looking for it early, because you are definitely at higher risk. So this is there is a genetic component to it. It isn't a genetic disease that, you have to have a family history, but that's definitely a good point.
I got two questions about the free stool test that they were giving.
The Cologuard, yes.
No, not Cologuard, the other one that they have for free.
The fit test?
Is that, huh?
The fit.
Well, they're both free.
Well, you said it was $700.
No. That's what it would cost if you were to pay for it. But because you're on Medicare, it's free. That's what, if you have a 30-year-old kid who says, I'm worried about colon cancer, I want to do the Cologuard. Insurance won't pay for it for a 30-year-old kid, and it's going to cost him $700. With Medicare, Medicare picks up the full tab. It is free, including the shipping.
The other question is, you say after you have the colonoscopy, you wake up, can I drive home?
Somebody's going to drive you because they gave you sedation. It's the same thing as if you go to the dentist and you have a root canal, they're going to knock you out a little bit. And you want somebody to drive you.
If I wait like 5 hours,
You know, the correct answer is somebody should drive you. The real answer is sure, people do that all the time. They take a cab home or an Uber, but you got to wait a couple hours because you're going to be pretty loopy after this test. I mean, it's not general anesthesia, like, you know, taking out your appendix, but you're not going to feel anything and you're going to be pretty out. So
doesn't the hospital have a cab service?
no, there is no service. There used to be. Hospital used to send a car for you and a car to go back. Everybody's running out of money. So no, you need to arrange transport. Sir,
I had one about 6 years ago. I mean, no, not six, last year. They gave me a kit. And they said I had to find colors. That that's the test. So I just one of those kits I had to do myself. And I sent it in.
you're a star. You're not going to get colon cancer.
Do they work over 50 something?
I'm not exactly sure what that kit would be.
Yeah, I know.
But if they did a colonoscopy on you last year and it was clean,
Yeah.
you're golden.
I just wanted to share something I have. Obviously, I have to do it.
Can you speak up just a teeny bit?
I did the Cologuard test that we're talking about, the easy one. But and I sent it in, but they said there was another excrement. So I became.
You know, these tests are what they are. If you did a Cologuard and they said the sample wasn't sufficient, or you didn't pour enough liquid on it, or the cap came loose, you just call your doctor and they'll send you another one, no charge. No charge, no problem at all. It's easy. And you know, just as a thing, the worst thing you could hear from the doctor when you wake up from the colonoscopy is, ooh, we found something bad. The second worst thing you could hear from the doctor is, you didn't clean yourself out good enough. We got to do it again next week. And you really don't want to hear that because the prep is pardon the expression, but it's a pain in the ass. You drink this stuff and you're sitting on the toilet for a couple hours because they really want you to be cleaned out. So when they go in and take a look, they're not seeing a bunch of poop. So, yeah. But yeah, if you get a report back from Cologuard saying not enough stool or didn't prepare it right or it came loose, just do another one. No big deal. Sir.
Yeah, have they improved the sedation? Because the very first one I took, I was sedated. I didn't feel anything. Subsequently, after that, I started to feel that I was coming to before they were able to.
Yeah.
I felt a little bit of the jerking of that too.
All right. Well, the question is, how good is the sedation when we do the colonoscopy? And there's a couple different agents that they use for sedation. It's not important to know what they are. Everybody reacts differently. Sometimes they don't give you enough sedation and you can kind of feel something or be a little drowsy or wake up halfway through it. This does happen. And when that happens, they just usually give you a little bit more.
It was very painful. When you wake up in the middle of that and you don't.
Yeah, but you don't want to be waking up. I agree. And I must tell you, there used to be doctors years ago, usually surgeons rather than gastroenterologists, who were afraid to sedate the patients. And they did these colonoscopies without sedation, which was just absurd. But you can hear people tell stories. Oh yeah, I had one without sedation. And oh my God, that doesn't happen anymore. And, you know, I mean, they got this down pretty much now, that when they give you the sedation, they make sure you're out. You're pretty looped. And if you're not out, you're out enough that it doesn't hurt.
I mean, do you have to tell, I mean, they'll know if you're out?
Oh yeah. Oh yeah. I mean, it's been a few years since I had my last one, but I remember as I'd give them 2 milligrams of this and that, as you know, why don't we roll him over on his side? And I say, not yet. See? And is that give him another milligram, and that's all I remember is give him another milligram. So yeah, they're gonna check you. It's same as when you have dental work. They're gonna tap that, make sure it's numb first.
Oh, I have it.
Yes.
Now, polyps and colon cancer, is that from your intestine or is it inside your rectum?
Well, that's why they call it colorectal cancer, because the rectum is like the last part of the colon before you get out into the fresh air. So it's really, the rectum is, oh, yeah, we have a polyp here. If you have a polyp this big, you got some serious problems. Yeah, if you want to think about it in basic terms, the gastrointestinal tract is one long tube that starts with the mouth and ends in the rectum. The end of the tube is the large intestine, which is the colon, and that goes out to the air, fresh air, through the rectum. So the rectum is, for all intent and purposes, the end of the colon. So that polyp can grow in the large intestine or colon, or it can grow in the colon. And treatments are the same. You catch it early and get the polyp out. Catch it late, and they do surgery to fix it. And catch it real late, they do surgery and chemotherapy or radiation. The whole trick is catching it early. And that's what the push is this month.
But you're supposed to, if it's clear when you have it, you don't have to have another one for 10 years.
That's correct. Yeah, so that's kind of the problem, or a problem. How long does it take for these polyps to develop? You have a colonoscopy and it's negative. There's nothing there. They say, come on back in 10 years. Cool. Is it possible that in that 10-year period, you grew a polyp, the polyp became malignant? Yeah, it is. But by crunching numbers and looking at statistics, they say if you didn't have one, it's unlikely that one is going to pop up within 10 years. That's why if you do have a polyp, they say come back in a couple of 2-3 years. A lot of docs, what they're doing is saying to you, get a colonoscopy. And if it's clean, in 3 or 4 years, get a Cologuard. It's free. And if that's clean, get another one in a couple of 2-3 years. So it's a question. Again, talking about screening tests, mammograms are a classic screening test everybody knows. And the old rule was do one every year. Well, if it's good to do one every year, wouldn't it be better to do one every 10 months? How about every 6 months? How about once a week? How about every day? At what point does it not make sense? So with the colonoscopy, it's not a simple mammogram. It's a whole procedure. So after crunching numbers over the years, the big experts at the CDC and whatnot said, if it's clean, 10 years is a reasonable number. And that's where they came up with that 10 years.
Can I just ask the last question from me?
Please.
Okay, with the program now and educating the public about this problem, did the medical profession, did they see an increase or decrease or about the same? What is the program doing to the general population about this program that you have that makes the colorectal cancer?
The question essentially is, are we doing a good job with colon cancer prevention by doing these screening procedures? And I don't have statistics at my fingertips, but we're doing a good job. We're definitely picking up a lot of early, preventable cancers, polyps and such. We're not there yet. We're not there yet because, I mean, let's be totally honest here. When you explain what a colonoscopy is, you're sitting there kind of going, ew, really? Ew. And a lot of people just don't want to get it. And they talk to their friends who said, oh yeah, I had a colonoscopy and that prep the night before was awful. Or I woke up and, oh my God. The vast majority of colonoscopies go perfectly smooth, and that's not a problem. But a lot of people just plain say, I don't want one, ick. And that was that. Now with Cologuard, you've got another option, a really good option. If a colonoscopy is 100% accurate, Cologuard's about 92% accurate. Ain't great, but it's pretty great. And you don't have to go through the whole big procedure. So yeah, we're making a lot of progress. And if you watch, the TV talk shows on Sunday morning or the news shows, you'll see ads for Cologuard all over the place, because the push is, do this, get this test, and let's make colon cancer a thing of the past, just like we talk about polio. Oh yeah, I remember when polio was a thing. It's not much of a thing anymore. That could be colon cancer, but part of the job is getting the message out there, and part of the job is getting the doctors to push it and push the message to the patients.
Can I say something?
Please.
So if you opt, or if you share this information with someone, your loved ones in your family, or just friends in general, Cologuard, you have to go to your doctor to get this, to get the kit started. Once you are intertwined with Cologuard, Cologuard has over 90 various languages that are that they are able to respond to. So they'll have a representative that you can speak with that can explain everything in more detail to you. Cologuard for the younger population, 45 and above, is covered by most insurances, Medicaid. And also, if your Cologuard test comes back positive prior to this year, I think it was the end of last year, beginning of this year, the laws have changed it, because Medicare only gives you like one screening per year that they'll pay for. Now, this Cologuard, if you opt to take this Cologuard and it comes out positive, they will still pay for a regular colonoscopy. So the laws have changed in that
Right.
respect.
So if there's no other questions, I would like to thank you all for your kind attention. It's been my honor and privilege to speak to you. Good. All right,
I'm just trying to stop the.
Thank you.
40 minutes, not bad. Yes.
With the other, when I did mine, when they started me, was the gallon liquid. They have very little.
It's much
So the
easier.
oncologist used to go and do it without the hassle.
When I did the prep the first time about 20 years ago, I had a group of gals. The first class, I'm saying,